Today I'm going to discuss on psychopathology of mental disorders. At the end of the class, the student will be able to understand the meaning of psychopathology and describe the deviations from normal behavior. So let us see what psychopathology is. Psychopathology is the study of abnormal cognition, behavior, and experiences. It can be broadly separated into descriptive and explanatory. Descriptive psychopathology is the field of study which involves in the observation and categorization of abnormal psych events, the internal experiences of the patient, and his subsequent behavior. The disordered behavior could be due to disorders of personality, activity, perception, thinking, affect, attention, consciousness, memory, and structural disturbances in the brain. Whereas the explanatory psychopathology looks to find explanations for certain kinds of symptoms according to theoretical models such as psychodynamics, cognitive behavioral therapy. Let us look at the deviations from normal behavior. They are disorders of personality, disorders of motor aspects of behavior, disorders of perception, disorders of thinking, disorders of affect, disorders of attention, disorders of consciousness, and disorders of memory. First, let us look at the disorders of personality. A personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with a personality disorder has trouble perceiving and relating to situations and people. This causes significant problems and limitations in the relationship, social activities, work, and school. Let us look at the types of disorders of personality, namely cyclothymic personality, hypomanic personality, melancholic personality, paranoid personality, schizoid personality, obsessive compulsive personality, hysterical personality, passive aggressive personality, explosive personality, inadequate personality. So, what are the disorders of motor aspects of behavior? Motor disturbances are related to action or impulse towards action. Activities are associated with will to do, that is the attitude, and wish to do, feeling. So, the disturbances of activities are as follows: overactivity, decreased activity, stereotypy, repetitious activities, automatic behavior, negativism, compulsion, violence, and suicide. Looking at the disorders of perception are classified as illusions and hallucinations. Illusion basically are the misinterpretation of perception of a sensory experience. It occurs due to individual emotional state, needs, and fears, whereas hallucination is perception occurring in the absence of the object. They are not related to any external stimuli. Coming to the disorders of thinking, ideas are connected by imaging, conceiving, inferring, and other processes, thus forming new ideas. Since thought is the most highly organized psychobiological integration which occurs internally, adequate attention has to be paid in the production, progression, and content of thoughts. Coming to the disturbances of affect, there are two concepts, the mood and the affect. Mood is a temporary state of mind or feeling, whereas affect influences our ideas and thoughts as well as the serves as a warning signal to refrain from forbidden act. Disturbances of affect can be classified as pleasurable affects, depression, anxiety, inadequate affect, inappropriate affect, ambivalence, and depersonalization. The disturbances of attention, it is basically impaired in various psychological and psychiatric condition, so they are unable to control the focus of their attention. Sometimes this is interpreted as defensive due to psychological mechanism, or it is seen as the outcome of physiological disturbances. They are classified as follows: disordered attention, distractibility, selective inattention, hypervigilance, trance, and illumination. The disorders of consciousness, the continuum of impaired states of consciousness extends from confusion, clouding, delirium, dream and fugue states to complex stupor. Finally, the disorders of memory. It is a function when information is acquired, presented to the consciousness, stored, and later recalled. There are three processes basically: registration, retention, and recall. The registration is the reception of the mental impression, retention, preservation of the previously acquired impression, and recall, reproduction of the impression. There are several disorders of memory: amnesia, a partial or total loss of memory; hyperamnesia is the unusual power or enhancement of memory; and paraamnesia, a disorder of the memory or the faculty of the recognition in which dreams may be confused with reality. So, coming to the conclusion, every student needs to know the psychopathology of mental disorders so that a clear understanding of the symptoms is inferred to give care for the mentally ill patients appropriately. Thank you.